Monkeypox has been around for decades in Africa. So why is the western part of the world only paying attention now?
Any disease anywhere in the world that is neglected can spread everywhere. It's important to know that.
The rest of the world didn't invest in fighting monkeypox despite African doctors pushing for more resources for years. Oyewale Tomori has been a leading virologist in Africa. He says the public health crisis comes from countries neglecting the disease.
Before it became international, it was national emergency, wasn't it? So why are we waiting for the world before we begin to take action in Africa? So there's need for a proper study, a better understanding. There are too many gaps in the monkeypox thing that we need to focus on.
While no vaccines for monkeypox were available in Africa as of the end of June, the US plans to roll out 1.6 million doses this year.
I see Europe and everybody rolling out the vaccine. I don't think that's the right approach. The right approach would be identify the cases, isolate them, limit direct contact. In any case, we don't have enough vaccines around to go around.
Tomori is calling on Western media to do better reporting on the disease so it doesn't stigmatize African people.
Monkeypox first came out. The pictures you were seeing of cases in Europe were the pictures of Africans. I said, look, it's your pox. Let's be frank with you. It's your own pox this time. Why are you using my picture?
The main source of outbreak in Western countries has been from sexual contact among men. But monkeypox can be passed through any type of close contact.
First, not to create stigma against anybody, but also to understand that this is how this thing is spread, and therefore you can pitch your response. It is not only through sexual contact that you get it. The contamination of the environment, of your cloth, of your beddings, all those are ways you can get it. So are we going to forget that?
While monkeypox has created stigma against LGBTQ people, Tomori is warning countries against repeating past mistakes.
We had a similar experience when HIV came. We diverted our attention and focused on the so-called stigma. Then the disease was spreading all over Africa. We shouldn't make the same mistake with this one too.
Monkeypox was a disease mostly limited to African countries like DR Congo and Nigeria. The virus can actually be a self-limiting disease.
If you discover on time, you isolate the patient, limit the direct contact, it will be taken care of on its own.